Hello, everyone, and welcome back to SALT Talks. My name is John Darcy. I'm the managing director of SALT, which is a global thought leadership forum at the intersection of finance, technology, and public policy. SALT Talks are a digital interview series that we launched during this work from home period with leading investors, creators, and thinkers. And what we're trying to do on these SALT Talks is replicate the experience that we provide at our global conferences, the SALT Conference. And that's really to provide our audience a window into the minds of subject matter experts, as well as provide a platform for what we think are big ideas that are shaping the future. And we're very excited today to welcome Dean Michelle Williams to SALT Talks. Dean Williams is the Dean of Faculty for the Harvard Chan School of Public Health, as well as the Angelopoulos Professor in Public Health and International Development, which is a joint faculty appointment at the Harvard Chan School, as well as the Harvard Kennedy School. Dean Williams is an internationally renowned epidemiologist and public health scientist, an award-winning educator, and a widely recognized academic leader. Prior to becoming dean, she was the professor and chair of the Department of Epidemiology at Harvard Chan and program leader of the Population Health and Health Disparities Research Programs at Harvard's Clinical and Translational Sciences Center. Dean Williams previously had a distinguished career at the University of Washington School of Public Health. Her scientific work places special emphasis in the areas of reproductive, perinatal, pediatric, and molecular epidemiology. She was elected to the National Academy of Medicine in 2016. A reminder, if you have any questions for Dean Williams during today's talk, you can enter them in the Q&A box at the bottom of your video screen on Zoom. And hosting today's talk is Anthony Scaramucci, who's the founder and managing partner of Skybridge Capital. He's also the chairman of SALT. And with that, I'll turn it over to Anthony for the interview.
John, thank you. Dean Williams, it's just a great honor to have you on. The rumor has it, I've learned from mutual friends that you're from Queens. Is that true?
That's right. I'm from Queens Village.
All right. So are we a Met or a Yankee fan?
I am a Met fan.
Okay. So this is going to be an easy interview for you then, okay? I had two separate sets of questions. If you said Yankee fan, we were going with the really rough stuff, okay? So now I'm putting the rough stuff down. We're going with the layup questions, okay?
All right.
Because you've suffered enough, Dean. You've suffered enough. Let's face it, okay? We've lived in a house of pain for 4 decades. So, all right, well, terrific. Thank you for being on. How did you start this amazing career? Let's go from Queens Village to where you are today. And what were you thinking about as a kid, and how did you end up where you are?
Yeah, thanks for asking that question. I'm an immigrant kid. My parents immigrated to the United States when I was 7. And my father did that because he understood that education was really the social driver that lifts all boats. And while he wasn't afforded that opportunity, he wanted his kids, 3 girls, to have that. And so we ended up in Queens, New York, Cambridge Heights, Queens Village, and, public schools. I got noticed by really good teachers who recognized my talent and always worked to get me in the right classrooms at the right time. And, this is a great country where an immigrant kid can go to public schools in New York and end up at Ivy League education. I know, Anthony, that's not so dissimilar from your own background.
My mother thought it was Hartford Law School, Dean. Okay, so when I was packing the car for Labor Day weekend, 1986, my mother had the map out. She was heading for Hartford. I said, Mom, no, it's by Tufts. It's up in Boston. Why would they call it Hartford Law School if it's not in Hartford? So, that has been a standing joke in our family for the last 34 years.
Yeah.
So, no, I get it, but it's a real tribute to you, tribute to your family. And obviously, we both have a great fondness for the university. The United States is at a pretty difficult time. We're in the middle of, I would probably say it's the worst pandemic since some people are comparing it to the Hong Kong flu in the mid to late 60s, but I think it's more like Spanish flu. It feels that way to me, but you're the epidemiologist. Tell me what we're doing wrong. What would you suggest that we would do to have better mortality rates, get them more consistent with places like South Korea, curb the spread of the virus like Germany? What would you like to see done if you could wave the magic wand and you could be the epidemiological czar of the COVID-19 crisis?
That's a great question. And I'm going to try to approach it from a core fundamental place. Because, Anthony, this problem stems our lack of capacity to respond stems from some acute issues around lack of leadership and lack of trust and appropriate appreciation for science and scientists' voices. But there are also some long-term problems that led us to this place, and that is a chronic underinvestment in public health. Public health for far too long has been sort of unseen and undervalued and underinvested. And so we for too long have not had the appropriate investment in the public health workforce, the public health infrastructure, and the public health tools. I mean, the richest country in the world, we spend more money on health than anyone else, but we consistently rank in the bottom for all of the population health metrics. We've got to do better. Public health, I think what we've learned from COVID is public health is a primary factor in our civic life. It's a primary player that undergirds our economic security and our national security. So one of the things that went wrong, we can correct right now. And I think we have an opportunity to do that because there is an acute awareness now of the primacy of public health in society, in our business, and in our life, and in our national security. So rather than dwell on what we have gotten wrong, we need to seize this moment and turn it into a movement where the mission is to invest in public health, in the tools, the people, and the partnerships. And one of the things that I've seen happen, and we hope will continue to happen, is de-siloing the systems that we have. Academics should be working closely with government, should be working with philanthropists, should be working with the private sector, because we're all in this together. The private sector are now really fully realizing that they're in the public health business. And so it's one of the reasons we've created a program that brings CEO, leaders of the biggest and smallest companies, a full range of them, into the public health space where we can start to work together on infusing decisions around sustainable workforce, sustainable environment, building back trust with consumers by educating them with the core fundamental principles of disease prevention, health promotion, protection and preservation of health. And that happens through using data wisely to prepare for disasters, natural and man-made, and to have a response system that's robust.
Well, I mean, all that's right, and I want to get into the course, the C-suite course in a second, but I want to ask you two follow-up questions. And so the first one is related to the safety net in the United States, because I think we both grew up in certain areas of the country and have empathy for people that may not have done as well, frankly, as you and I have done from those areas of the country. And now with a great pandemic upon us, we realize our health system may be as weak as the weakest link in our health system. So I could be sitting here with a Cadillac health insurance policy, but now I've got people in my neighborhood that may not be doing as well, and they could get sick, which could lead to sickness in my family. So it's sort of this pervasive thing. And I'm wondering if this is going to create the awareness necessary to have something that is more sturdy at the bottom than even Obamacare, frankly. And again, I'm not calling for single health care paying. I believe that we should have a hybrid, more or less, as the vice president has expressed. But what are your thoughts on that? Do you think that this is a breakthrough moment for us politically on the healthcare and public healthcare side, or you think it's going to be status quo going forward?
It can't be status quo going forward. I'm going to be a strategic optimist, and I'm going to say that more of us across all sectors are learning that there is a huge cost that we are all paying, whether we are aware of it or not, by not having a good, solid safety net, right? Citi just released a report that put dollars to that problem of indifference around a social safety net. And that is driven in large part by our 401 years of inequality based on race and racism, right? Citi basically reported just a week or two ago that, our GDP has been hammered by at the order of $16 billion, by our inattentiveness to inequality, which is a very big factor around the issues of inequity and really poor health disparity outcomes that we see in the neighborhoods that we're familiar with and that you started to allude to. So I think that there is an increasing awareness that there is a cost to our indifference about the most vulnerable in our society. And it's not sustainable, nor is it wise economically for us to have a blind eye to this problem. And I am seeing many different people across sectors step up and take on responsibility in building capacity in communities that have been historically deprived, investing in schools, creating opportunities for meaningful jobs and economic employment for people who have been left behind. And I think I hope we can be really strategic in capturing the best lessons learned from these kinds of investments and bring them forward so that they can be brought to scale in communities that really need help.
I think it's very well said. You're also combating, again, this is my opinion, I'm editorializing a little, and if you disagree, please chime in. But I think we're also battling some level of information crisis. It's a misinformation crisis almost. We've got conflicting ideas about wearing masks versus not wearing masks. We have doctors inside the White House that say it's okay not to wear one. We have someone like Anthony Fauci insisting that it's important to, or Dr. Birx insisting that it's important to. How do you, at your level, combat that misinformation? What would you recommend to the average citizen to get more educated? What would you recommend here? Because we seem to have politicized now science, which has me very, very concerned.
Yeah. No, Anthony, that's a very important question. And I think the first thing we have to recognize is this is not new. That misinformation has been a challenge and a threat to public health for a very long time. But I think because we have had now several institutions be challenged because of the politicization of global health and public health, it does begin to feel like an existential threat. And indeed it is. I think the first thing that people have to recognize is if it sounds too good to be true, get your information from trusted sources. Academics are still, regarded as a trusted source of information. And one of the things that we have to do in the academy is to make sure that we are as deeply engaged in the national conversations and global conversations as we can be. And we should bring that information down to the level where people are at. I think it's going to take a whole society and all of our sectors to be very mindful, strategic, and proactive about seeking out those sources of misinformation and breaking the chain of dissemination of this information. And we're going to have to do some science, Anthony, because like all useful tools, sometimes they're going to be used for good and sometimes they're going to be used for bad. And we're going to have to develop appropriate policies that protect rights and freedom of speech, but also protect the public from harmful, misleading information.
How can businesses help in this area? How can they help prepare us better?
Yeah, that's a great question. I don't have an immediate answer, but I will tell you what's really important because I've seen businesses and leaders stand up and take a pro-public health position. Just speaking about how masks, very basic, very important instrument, public health instrument for breaking the chain of COVID-19 transmission. And for me as an academic, my entire professional life, to see C-suite executives for some of the biggest companies across different sectors stand up and make a clear statement to promote the use of masks was powerful. And I think every student of public health, every person in our nation and in the world should begin to recognize that it is an unfortunate past perception that business bad, not business good. that false dichotomy has, in a way, robbed us of the opportunity to work together collectively to have leaders in business be part of the narrative of a public health forward way of thinking and doing. So I think, if we break down silos and continue to engage in a conversation in the narrative about what is good for public health is also good in the overall conceptualization of society, we'll be a healthier place because we are in this together. And if COVID did anything for us, it made that so clear to all of us that one should not get caught up in the false dichotomy of trading business or wealth for health. They are intimately intertwined and they have to work together in order to bring forward an equitable society. CEOs play a big role in that.
Oh, and I appreciate you sharing that with us. This is more of a meta question, actually. This is something I've been thinking about. David Quammen in 2012 wrote a book called Spillover. And in the book, he basically is saying that we are now spilling over into the animal kingdom because of the size and scale of the human population, a result of which, and you have to forgive me because I never pronounce things right, but I think it's called zoonotic or zoonotic transfers of diseases. So you can get a virus in a bat, a horseshoe bat, or you can get a virus in pangolin or something like that, and all of a sudden it jumps into the human species, and we're not biologically prepared for it from an immunological perspective. Is that going to happen more and more? His contention, and he wrote the book in 2012, was that it would happen more and more, and he more or less predicted what unfolded in 2020. Is this something we need to be worried about?
That's a very important question, and I'll say that this is something from the perspective of understanding how climate change impacts human health. This is a very big question, and it is one of the primary pressing challenges to human health going forward. And it's why at the Harvard Chan School, we're focused very much on understanding how climate change, the many different ways climate change impacts human health. And this encroaching of zoonotic infections into the lives and livelihood of populations is in part a downstream consequence of changes in our physical environment. Change is brought about largely by how we live, work, and interact with our environment. How those changes contribute to alterations in our ecosystem that puts animals and pathogens more in line of our path. And this is where emerging and re-emerging infections as a result of climate change is one of our big challenges. Lyme disease is an example. As our environment changes and as vectors that carry these pathogens commingle in spaces where we are, we will end up with a higher likelihood of exposure and risks. And so, one of the things about public health, Anthony, is it's about connecting dots. And it's about understanding how we live and work and operate in our environment changes the environment in ways that either mitigate or amplify environmental risks to human health. And that's what he's getting at in the book.
Yeah, and it's a very interesting point. Fareed Zakaria, who we're going to be interviewing on Monday, he just wrote a book about the 10 lessons in the post-pandemic world. And in the book, he writes something that I wanted to ask you about, which is the butterfly effect. Something is happening on one side of the world. It seems like a minor thing, but it's having a deep impact on the rest of the world. And one thing that is happening as our societies are getting more Western in terms of their consumption-based style of capitalism, they're eating more meat products, as a result of which we're raising more animals to slaughter to create the consumption of meat. The introduction of antibiotics and other things to, help this process. Is it affecting the ecosystem in the way that it's also contributing to the situation we're living in now, like COVID-19, or will other situations sprout up from this? Or is this something not to worry about? If you talk to the farmers, they're dead set against it, but they are self-interested. They say not to worry about it. But if you talk to some biologists, they say, boy, we should really be worried about this disruption.
Yeah.
What's your opinion?
Anthony, this is really important. I got to tell you, because it touches on very many key topics. Let's just talk about.
If you said you were a Yankee fan, I wouldn't be asking these questions. But since you said you were a Met fan, I wouldn't express.
It's all right. It's all right. I have to say, I went to Bayside High School, and our colors were Mets colors. And the Mets played right outside of, they were right there. I mean, it's where I went to high school.
You got me at hello, Dean. You got me at hello, okay? I'm sending you the virtual hug, okay? The one that doesn't get you disease.
So the orange and blue. I'm an orange and blue girl.
Amen. So what do you think about that question, though? Where
I think it's really an important question, and I wish and I hope that more people are sort of get into this conversation, because just think about, we're in this together. We've got one planet, and the health of that planet is important to all of us. The fires that are happening out west right now, right? We on the East Coast, we're like, woe are they, because they are dealing with these fires and the smokes. But just think about, on any given day, the jet stream can bring that smoke right here on the East Coast, and it has already an impact, the respiratory function of all of us, those who are close as well as those who are distant. Antimicrobial resistance, right? This is where some of public health and medicine's best tools for life-saving against infectious disease. We're running out of medications to help protect us from emerging and re-emerging infections because of overuse of antibiotics. And, we can't say it's their problem because they're over there overusing antibiotics. If there is a problem in one part of the world, it's everybody's problem. And I think it's really fundamentally important for us to use this moment to educate people that this is everybody's problem. When we were watching COVID, sort of shut down the East Coast cities, cities where we grew up and where we still live, I knew that our friends in the Southeast, in the rural communities, were going to get hammered. And the idea was, let's communicate to them now that we're all in this together. It's an infectious disease. It is a contagion. And it's only a matter of time before it hits your communities. So let's work collectively, collaboratively in preventing the spread of this disease. We have to get to a place where people understand that we are all part of a social contract to each other for our own sustainability and for the sustainability of the planet that we want to live on, and we want our children and their children to thrive. It's fundamental that we have more people understand that we have a collective responsibility to protect our physical environment and do so in a way that is sustainable and equitable.
I have a few more questions. John has obviously got a ton of questions that are queuing up from our audience participation, Dean. But and I think it's well said. But I want to get to the central idea for public health and public safety. And so let's go across the spectrum. Everybody needs healthcare in a rich country like yours, yes or no?
Yes. But can I just say, it's not just about healthcare. 80 to 90% of what we call health and wellness happens upstream and outside of the healthcare delivery system. Health and wellness is driven by factors that are not in hospitals. They're driven by equitable educational opportunities, living wage, secure housing, healthy foods, a place to live, learn, work, and play that supports the enable of our mental health and wellness, as well as our physical health. And we have to get society to understand that health doesn't begin in a hospital. It begins long before that, and it's intergenerational.
Yeah, and it's obviously, the way we eat and and drink, obviously, and smoke. It has a big impact on this stuff, and so we agree. So, but you are saying we do need a healthcare system that provides coverage for all of us. I think we would agree on that, but I want to hear from you.
Yes.
And then the secondary thing, I guess, what I have for you is related to what your statement is about the prevention of poor health, and that is creating a platform of equal opportunity. You obviously got raised in a middle class neighborhood or lower middle class neighborhood, like I did, but you had some good teaching, maybe some great parents, a combination of different things, and lo and behold, you're now where you are. How do we try to create that platform of opportunity for people that were similarly situated? And it seems like it's tougher today, Dean, based on my observation and my travels around the United States. It's tougher today. What do we have to do?
Yeah, I think having a conversation like this is key. I think we have to communicate that building these platforms, sustaining these platforms that enable the thriving of populations is good for business. I think it's important to recognize that having a public safety net is not charity. It is essential. It is the bedrock for doing good business, because having the public health values of health promotion and prevention of diseases built into your business plan ensures that you've got a healthy and thriving workforce that is present at work, right? And it ensures that the consumers have the security and the enthusiasm about engaging in civil society and in commerce. And we need to have that virtuous cycle of health, wellness, and the investment in sustaining that health and wellness to keep the workforce, the human capacity, both on the production side as well as the commerce side going. Public health is fundamental to our economic as well as national security. So the idea here is to point out whenever possible and to everybody the returns on investment for securing, supporting, and enabling populations to develop healthfully across the life course is good for business, it's good for society, and one should not have to be put in a position to choose wealth over health. They are inextricably intertwined in ways that we have to appreciate and support.
Well, I mean, it's very well said. And I think one of the big issues, and something happened, we could talk about this, but probably need some sociological help as well. But we're starting to care more about ourselves and less about each other. And a result of which now, we're moving away from each other and we're sort of stockading each other. But you can't do that because you don't want to be, like I said, living in that McMansion while your fellow neighbor is suffering. We have to figure out how to, and again, my capitalist friends, I'm obviously a capitalist. My capitalist friends don't get it. If they don't start acting now through the C-suite, through the corporations, it's going to be mandated upon them by the government. And that's going to create a misallocation of resources as opposed to having a private public partnership to get it done, which would probably be more efficient and more offer greater economic utility to everybody. So, well, Dean, this has been terrific. I really appreciate the opportunity for you to speak with us. We've got a ton more questions, but we always, at this point in our conversation, we flip it over to the audience. And so I'm going to turn it over to John Darcy, who's trying to outshine us with that stupid bookcase of his, but that's okay. I'm in the Beverly Hills Hotel. So I just want everybody to know when this Saltcast's over, I'm going out to the cabana by the pool. So it won't necessarily be on Room Rater, but I'm gonna have a better room rating than both of you guys in about an hour. I just want everybody to know that. Go ahead, John.
I can't argue with that, and hopefully the fumes from those fires and things aren't filtering down to the Beverly Hills Hotel, Anthony. And
pretty good air quality today.
We pray for your good health. So, Dean, I want you to talk about. I understand there is a course that you have launched for C-suite executives to educate people in business about what they can do to keep their employees and their customers healthy and contribute to a lot of the public health issues that you've spoken about on this call. Could you tell us more about that course, why you launched it, and why it's so important today that we get business leaders more educated about these topics?
Sure, John. Thanks for that. The course came about through a number of conversations I was having with the CEOs from a number of companies across different sectors. And these conversations started around, we've got a novel virus that is threatening the globe. And I've got, workers and I've got consumers who have questions. And the questions are around how do we respond during a time of crisis in a way that is ensuring public safety. And so these conversations, the pattern was, how do we bring public health? How do we bring risk management and risk mitigation principles into the business plan going forward while we manage COVID and after COVID? And so the conversations across multiple sectors with a number of CEOs led us to creating a course. And the course is really to bring the foundational knowledge of public health, which is prevention, preparedness, and response oriented to begin with, into the modeling and business planning of across different sectors. So that's what we're doing. I think my colleagues gave you a link to the launch, to the website, but the goal here is to put together academic and private and public partnerships in a way where we share knowledge, actionable knowledge that allows one to address concerns that would impact the health and wellness and safety of a workforce, and would address concerns that consumers will have about what safety protocols are put into place and how those protocols are designed to really allow for a safe way to re-engage in commerce. It's been an incredible opportunity to de-silo the work that we do in the business sector and the academic sector. And it's created an opportunity to put public health really into the bedrock of business planning.
Yeah, it's interesting you talk about that decoupling. I think we've all experienced sort of a coming together of our work life and our home life. And you talked about the important need to create a social safety net and to create environments at home for people so that they can, become more educated about public health, so they can reinforce good habits. How do you think the pandemic long-term is going to affect the workplace, the workforce, and how we blend our personal life and our business life? And again, going back to Anthony's question about solutions for preventive healthcare, what types of measures would you like to see put in place that could solve a lot of those things with a view towards the post-pandemic workplace and workforce?
Yeah. Well, I think work is going to be defined differently. What is work is now constantly being evaluated. First of all, the health and safety of the workforce is now more front and center than before. If you've noticed, when do you start to define and end the definition of essential workers, right? The pandemic has forced us to realize just how incredibly important our workforce is across all of the different domains. And the fact is, the challenge to identify a part of the workforce that's non-essential is almost impossible, right? People are now seeing how low wage, low income earners are so fundamental to the way our society has to operate. Where we work and where we have to work is also being upended. We have all learned that we can use technology to adapt to working remotely and to have some very big benefits where we are adding hours back to our life because we're not commuting as much, and the physical environment's being improved because carbon emissions are brought down because we're not zipping across the continents for a half-day meeting and zipping back. So we are learning through these natural experiments that we can conduct our business without as much travel and without as much place-based embeddedness as before pre-COVID. Now, there are going to be some challenges. The mental health burden that is being illustrated across all sectors as a result of the uncertainty and the physical threats of this pandemic not to mention the economic fallout that so many people are suffering from job loss, has brought forward a very high burden of mental health illnesses that we have to take care of. So, as a public health person who connects the dots, I can go on about the many good things that we've learned as a result of COVID around what the workforce can look like and what the workplace can be defined going forward, and some of the bad things. Just one other point. The fact that we can now use a telemedicine platform to deliver healthcare should be a very important lesson for those of us who live in communities where the ratio of medical specialists to the need are not in a good space or place for healthcare delivery. And we have learned some important lessons about the adoption and the reception and how enthusiastically patients receive telemedicine, to think about how we can use that platform to better provide high quality primary care at lower costs and at greater levels of accessibility.
Yeah, to your point, my brother's a radiologist, and there's a dearth of qualified radiologists around the country, but they've found ways to use technology. Some people talk about how things like AI could replace certain elements of, physical doctors, but really it's a tool to enhance and scale quality healthcare. So it's a really exciting development.
Yeah.
So I want to talk about global cooperation. So we've talked about the United States, how individually we've had a difficult time containing the virus. Some other countries have done better, and they've adopted different policies that have allowed them to not maybe fully extinguish the virus, but limit the spread and limit the mortality rate. The World Health Organization has come under some criticism for its sort of slow response early on in the pandemic and some of the steps that it took. But without really diving necessarily into the WHO, what are ways globally that we can do a better job of coordinating responses, and not just responses, coordinating prevention of the spread of pathological diseases as well as general public health issues?
Yeah. No, thank you for that question. I would say the World Health Organization, the FDA, the Centers for Disease Control, these are vitally important institutions that support our public health and global health agendas. And they've all been challenged for local and global reasons. The World Health Organization has a very difficult and complex mandate, and that is to anticipate and to respond to threats to human health globally. And that requires leadership and a commitment of leadership to collaborating and being thoughtful about local and global governance issues. And I have to say that as an institution, I'm hopeful that we will get back to a place where the US is appropriately involved and engaged as a global citizen, as a leader in positioning the World Health Organization to be responsible to our needs. It's as I was saying to Anthony earlier, the threats to humanity know no boundaries. And COVID makes that very clear. Antimicrobial resistance, air pollution, the issues around climate change. These are threats that are global in scope. And we have to find ways to have public, private, global governance engaged and committed to collaboration, to problem solving. And I think academic leaders like myself and others across the country have to use our voices to promote to populations everywhere that decisions around leadership have to include leadership that is invested in a public health and a global health mission. Because the challenges are enormous, but we do have the talent and the capacity if we choose to work together to address these problems. And it can't be an isolated solution. It's got to be where the global good of these solutions are appreciated and there's a commitment to make them a global good. For example, for us to get back to a sense of normal post-COVID, we will need for leaders to recognize that safe and efficacious vaccines have to be managed as a global good. That is the quintessential challenge in front of all of us right now. It is a public health and global health challenge. And the CDC, FDA, WHO are all needed to be strong institutions to help us operationalize on that global good.
Yeah, it's one of the disheartening things that you see is that some people, let's take polio as an example. We've eradicated basically polio from our society. But you have people today who say, well, the disease has been eradicated. We don't need to take the vaccine anymore. We don't need to vaccinate our children. And you're starting actually to see an uptick in cases of polio because people are unwilling to get their children vaccinated for personal reasons, but really it's more about the public good. So it's difficult in a society like the United States, which values freedom and personal choice, to ensure that people make those decisions that are part of the greater good.
Yeah. I think it's incumbent on us to educate. I don't mean to preach,
right?
And I don't mean to
Please
judge.
do preach. Please do preach.
But I think it's incumbent of us to share the public health values and to illustrate how, this issue of a social contract that we all have for each other, for our family members, for our communities, for our society, and for the planet, brings us together as a human race, that we have to find ways to work together and to think that it's not just the individual, because I overuse this word, but we're so deeply interconnected, even more so now because of the technology and our ease of travel.
Right. Well, Dean Williams, we're so thankful for you taking the time to speak with us. I know in the middle of a global pandemic, you're as busy as anybody in the world right now, not just managing all of your academic responsibilities, but also trying to help solve some of these social issues. So we're very grateful. And we want to remind everyone about that course at the Harvard Chan School of Public Health. We're going to send a link around to everyone who registered for this talk. And also we're going to send the link on all of our social media outlets as well to that course where you can go online and learn more about it. And we're going to try to get Anthony involved in that as well, so we can make sure that our Skybridge staff is not just healthy in the pandemic, but reinforces strong public health principles going forward.
Awesome.
He's eating a lot of junk food, Dean. Okay, he's taking advantage of his youth and his metabolism. I just want you to know that. Okay, I'm like only eating junk food 16 hours a day. John is eating at 24. I just want everybody to know. Okay, I'm down to 16 hours a day of junk food, Dean.
Well, listen, I went to your restaurant I took my son for a special dinner at
great.
Hunt and Fish Club. Love the food.
Great. I had no idea. Well, that's something I gotta let you know. We can't open until Broadway opens, unfortunately. But we'll be back. I know.
But it was one of my most memorable dinners. It was mom taking her son out to a fancy dinner, and we had a great time. I wanted to thank you.
Okay, well, good. All right, well, thank you so much for doing that. And of course, there's no shortage of desserts at the Hunt and Fish Club. But in any event, you were terrific, Dean. I hope we can get you back after the election and talk about the future of the public health and awareness for people in the United States. Thank you so much, for people around the world, for that matter.
Thank you, Anthony. Appreciate the opportunity.
All the best. I hope I can get up there and see you at some point. If they let me back on campus, we'll have to see if they'll let me back on.
Oh, you got to come over to the School of Public Health campus. You're welcome anytime.
Okay, all right. Because I think they put an electric fence around Harvard Law School after I went to work for Trump. I don't know if I get electrocuted on the way in, but I'll come over. I'll come over to the public health school anytime.
All right.
All right. Be well.
Be well. Thank you. Bye-bye, Tony. Anthony. Bye-bye, John.
Bye.